Hello, my name is Louisa Liu. I'm a second-year internal medicine resident at the University of California, Riverside. I'll be presenting our clinical vignette entitled Unprovoked Azygos Vein Thrombosis, Provoking a Search for Occult Malignancy. Azygos vein thrombosis is essentially a deep vein thrombosis that develops within the azygos vein. It's a rare condition with fewer than 20 cases described in the literature. Almost all of these reported cases had identifiable predisposing factors, such as existing azygos vein aneurysms, peripherally inserted central catheters, E. coli sepsis, underlying antiphospholipid syndrome, and spinal epidural abscess. Recently, COVID-19 infection has also made way for at least 5 additional cases of azygos vein thrombosis due to increased hypercoagulable states. Here we present a case of isolated azygos vein thrombosis in a 47-year-old female who presented to the emergency department with chest pain for 3 days. She described the pain as dull, non-radiating, non-exertional, and not associated with shortness of breath. Upon presentation, her vital signs were stable. EKG, cardiac enzymes, coagulation profile, and chest radiograph were all normal. Her complete blood count was notable for microcytic anemia with a hemoglobin of 9.2 and an iron panel consistent with iron deficiency. D-dimer was elevated at 0.56. CT angiogram of the chest showed no evidence of pulmonary embolism. However, as you can see in figure 1, it did reveal a thrombus in the azygos vein as it drained into the superior vena cava. The patient was treated with IV heparin in the hospital, her chest pain resolved, and she was ultimately discharged home on apixaban. During her hospitalization, we attempted to determine the etiology of her isolated thrombosis, specifically whether she had any acquired or hereditary risk factors. She denied any recent trauma or surgeries, prolonged immobility, oral contraceptive pills, hormone replacement therapy, and previous history of deep vein thromboses or pulmonary embolisms. However, upon further questioning, the patient revealed she had a previous history of 6 miscarriages and 1 ectopic pregnancy. She also mentioned a family history of ovarian cancer and her mother diagnosed at age 29, as well as her maternal aunt diagnosed at age 35. Her obstetric complications initially raised concern for antiphospholipid syndrome. However, lupus anticoagulant was not detected. Anticardiolipin IgG and IgM and beta-2-glycoprotein 1 IgG and IgM were all within normal limits. Additional thrombophilia workup, including factor V Leiden, prothrombin mutation, antithrombin 3 activity, and protein CNS activity, were normal. We diagnosed the patient with an unprovoked DVT at the time. Studies have estimated that approximately 10% of patients in whom an unprovoked DVT is diagnosed, malignancy will be found within 1 year. This, in addition to the patient's unexplained iron deficiency anemia and concerning family history, led us to our suspicion for an underlying gastrointestinal malignancy, and we recommended our patient follow up with her PCP and obtain an outpatient colonoscopy. However, it should be noted that extensive malignancy evaluation in all patients with unprovoked venous thromboembolisms is not warranted. Establishing effective malignancy screening strategies for patients with a new diagnosis of unprovoked DVT remains an area of ongoing investigation. Because DVTs can be associated with virtually any malignancy, the screening required to thoroughly evaluate for underlying cancer can become invasive, expensive, time-consuming, and even cause psychological burden. Furthermore, no study to date has shown a survival benefit for patients with venous thromboembolism who undergo comprehensive cancer screening as compared to age-appropriate cancer screening. As it stands now, it's important to maintain a high level of clinical suspicion for malignancy in these patients without subjecting them to extensive and unnecessary testing. All patients with an idiopathic venous thromboembolism should undergo a complete history and physical exam, basic lab work, and be recommended for age-appropriate cancer screening. And then any abnormalities uncovered on this initial workup should be aggressively investigated. Thank you for listening.